Hello, my name is Bernadette McFadden. I'm a student here at Joyce, and today we will be going over the reflection for um, for the C-section and hysterectomy video. First and foremost, this video pretty much gave an overall view of a patient who was, I believe, 36 weeks pregnant. She also was going to have a C-section and a hysterectomy all in one. The video did show them performing the C-section. I believe that it also showed where the placenta was moving into what is, I can't think of that word, but it was growing into the fetus. um, I'm not sure if that's the fetus or not, but the wall, the liner, the inner liner of the uterus wall. Um, so it was important. Normally they would remove something like that, but because patient was already having a C-section, um, that would most likely increase loss of blood for the patient, which wouldn't be the best outcome, given the fact that she's going to have a hysterectomy. She just had a C-section, so the providers didn't want to take that risk. What did I feel watching the video? I thought the video was very informative. It was good to see a procedure such as that, what actually happens in the OR. One thing that I could tell is that this was a procedure that was common to the providers because they knew exactly what to do. They were shouting out other things. I noticed when the provider didn't hear any of the nurses call out the sex of the baby, he quickly identified the sex of the baby as soon as he was able to. So some pointers that I would learn, or that I did learn, is doing multiple procedures in one could cause a negative outcome. Most importantly, blood loss. So it's going to be important that we prioritize what needs to be done, and that everyone knows what's delegated to them. I think everyone worked so well together during this video. And it was good to see. It was good to see providers who were communicating with each other. Everyone was on one accord. So it made the procedure kind of flow a lot better, which was phenomenal. Um, Describe what you learned and what you would have done differently. I mean, I've learned a lot. That's for sure. Watching the video, I believe that the patient wasn't a good candidate for a natural birth, vaginal birth. So knowing the background of your patient is going to go a long way. I think that's a broad aspect of going into the OR. You have to know the background. And it sounds like the providers knew the condition that they were working with, and they were comfortable working with those conditions, which looked amazing, as everyone, there was a lot of intercommunication between all parties involved, which was great. Um, I don't think that I would do anything differently. I'm a new nurse, so I don't think that I would do anything differently. Educated myself a little bit more probably beforehand, knowing what we're going to be looking at, and preparing myself. But outside of that, I think all of the providers on hand did a phenomenal job. The video was very interesting. I almost wasn't fit for the cut, but I said, well, this is the field I'm going to be in, so let's go for it. So we quickly got over the C-section cut, so, or the incision rather. But yeah, I thought the video was very informative. It was definitely good to see a procedure like that, or multiple procedures.